Exposure to rabies can be scary, but if untreated, the consequences can be even more frightening.
Was someone bitten by an animal? Were they scratched? Or was there some other type of exposure? We have to assume that it could be a rabies exposure and take action. You don't really want to be wasting time with rabies because some of the onset of disease with rabies can be very short.
In this short video, we will explain what you should do if you suspect that you have been exposed to rabies. It's pretty simple. If you suspect a rabies exposure, seek immediate medical attention. Go to your nearest emergency room.
I came to the ER right away. Do you think I've been exposed to rabies?
Well, I'm glad you're here. This does sound like a rabies exposure. But the good news is we have preventative treatments endorsed by the CDC.
Prompt attention is crucial. There are 5 clinical stages of rabies: incubation, prodrome, acute neurologic syndrome, coma, and death. The incubation period is the time between exposure and the appearance of symptoms. The rabies virus is first present at the bite wound, but the virus must travel to the brain before it causes symptoms. This period can last from 5 days to many years, but on average it is 35 days. The prodromal phase is when the virus reaches the central nervous system. As the concentration of the virus in the brain increases, symptoms of infection appear. Prodrome is defined by nonspecific flu-like symptoms, such as low-grade fever, chills, malaise, nausea, headache, weakness, and muscle pain. Unfortunately, once clinical symptoms begin in the prodrome phase, very few patients survive. Thus, preventing rabies from spreading beyond the wound site is important for rabies prophylaxis. The prodrome phase may last from 0 to 10 days. Next comes the acute neurologic stage, where the virus becomes widespread in the central nervous system and begins to spread to innervated areas. This typically lasts for 2 to 7 days. After the acute phase, rabies progresses to coma and then death. Death usually occurs within 2 weeks from the onset of the coma. It's important to note, rabies may not be suspected until the acute neurologic stage, when it is too late to treat.
So from the time of exposure until the time symptoms of rabies start, that's the incubation, and that would be the time to stop it. Rabies immune globulin is used in that post-exposure setting to provide the immediate protection. And that's where the vaccines take over, because rabies vaccine is going to make sure that that patient is still protected going forward.
We hope this video helps explain the basics, how you can recognize the risk of rabies exposure to get medical care quickly. Rabies is essentially 100% fatal if not treated promptly and correctly. Learn more at rabieswatch.com.